So we're going to talk about male pelvic pain. Beth, can you tell us a bit about the common conditions associated with male pelvic pain to start with, please?
Yeah, so firstly, just to say that pelvic pain refers to any pain between the belly button and the buttocks, and that has been present for 3 months or more. And it can be associated with a number of common conditions. Those include things like bladder pain, sexual dysfunction, recurrent urinary infections, prostatitis, hernias, irritable bowel syndrome, psychological stress, and also irritation of the pudendal nerve or pudendal neuralgia. So that's just some of the conditions. And symptoms can be quite widespread. So they may be pain in the genitals, the rectum area, the testicles, the penis, or the lower back. Can be associated with excessive urination, poor urinary flow, erectile dysfunction, pain with intercourse, pain whilst ejaculating, pain after intercourse, sometimes also include things like pain with prolonged sitting, and painful urination and bowel movements. So quite a number of different symptoms that some people may experience just one or two, and some many.
And is there anything physio can help with? Have we got any tools?
Yeah, so we absolutely do. Historically, chronic pelvic pain, both for men and women, has been quite poorly understood. It's not been an area that attracts so much research and evidence, but we are gradually building that up now. There's no one thing, there's no magic wand, there's no one antibiotic that's going to solve the problems for you. Unfortunately, it tends to be a bit of trial and error, and a combination of trying different strategies, perhaps different exercises, different techniques that can be very individualised, and together obviously physio can help guide around some of those or many of those, and help you come up with a plan to try and improve your symptoms over time, and then gradually hopefully that will those symptoms will gradually decline for you. So things that can be helpful are around, if you have, it depends a little bit whether you have bladder or bowel problems, or what the nature of your symptoms are. If the bladder is troublesome, then something called bladder training can be effective. We do another video that talks a bit more about that. And also being mindful of just sort of general tips of how to help your bladder and your bowel work effectively and normally. So again, there's some other videos on bowel and bladder tips, so it would be worth having a look through there. There are other techniques and strategies that can be helpful. When we have persistent pain, it tends to sensitise and affect our central nervous system, because that pain has been present for some time, and that can really ramp up symptoms and affect things longer term. So if we're able to adjust the central nervous system and try and calm things down, then that can really be a helpful strategy, and there's lots of ways of doing that, but some of those include mindfulness techniques, meditation, guided meditation, relaxation, breathing techniques, and again we have covered some of this in some other videos around the diaphragmatic breathing, and we will have a video about down training or relaxing of the pelvic floor, which may well be helpful in this scenario, because with that pain often the pelvic floor muscles can become overactive and tense and quite sensitised. So if we can tap into that and calm things down, then that can often be quite helpful. And sometimes there are sort of diet and exercise interventions that can be helpful as well. Diet in supporting our bowels, and there are certain things, for instance, that we drink, like caffeine, which can irritate things further, so being mindful of that. And in general, exercise can, within your limits of pain and abilities, be helpful, even if that's just walking, gentle stretches, doing some regular exercise can be really helpful in managing things.